I am Dr. Eli Camp. Welcome. This is my podcast, Vital Wisdom. And this is where I talk about health, wellness, homesteading, raising children, and lots of other topics, all from the perspective of vitalism. I believe I've seen and taught others how the body can heal itself if it's given what it needs, it's not poisoned, and the innate healing ability of the body has been supported, not suppressed. It is my intention to bring what I have learned in my life, especially the last 24 years of being a physician, to help you be your own best doctor. Hope you enjoy the episodes, and thanks for being here. Hi, everyone. This is Dr. Eli Camp on Vital Wisdom. Thank you so much for joining me today. And I'd like to tell you a little bit about this book that I wrote called Homeopathy, A Foundational Approach. So I was introduced to homeopathy when I was in medical school, in my clinical training, although I had a few classes before I got to clinical training. And I have to say that there isn't another modality in my practice or type of therapy that I use that I have been able to affect change in people more than I have with homeopathy. Homeopathy is the use of very dilute substances to stimulate the body to heal itself. And as you know, if you follow my podcast, one of the things that I believe as a practitioner, my perspective, and I'm in good company of thousands and thousands of other doctors, is that the body is able to self-heal. We have to give it what it needs. We have to remove anything that is poisoning it, and we have to stimulate that natural healing ability, the innate healing ability that we have within us. And homeopathy is one of those tools in therapy that absolutely stimulates that healing within people. One of the very first times that I saw homeopathy work in a clinical setting was in a little boy. And I'll never forget it. It made such a dramatic impact on me and how I thought about what I was going to be able to do as a doctor. So this mom comes in, she was from France, and she walks into our clinic with this little boy, maybe 5 years old, 6 years old, I don't remember, draped in her arms, pale, very listless, moaning, clearly not feeling good. And I can remember thinking, why are you here and not at the emergency room? And she comes in and she says, I need a homeopathic remedy for my son. I think he might have an ear infection. And so I was brand new in clinic and not really allowed to do exams or anything like that. I was in observer mode. And we put her in a room, and the student who got assigned to her case as the lead on her case goes in and does an exam. And the doctor who was supervising the shift, Dr. Stephen Messer, actually comes in, looks in the ear. He has all the students in the room look in the ear. And what we saw was on the left ear, this really deep purple, bulging membrane in the ear, clearly an infection. And the child was very uncomfortable and making a lot of noise, but not really talking. So lots of moaning noises and things like that. And so the student takes the rest of the case, and we go back to the exam room to talk about it. And I knew very little about remedies at this time, but that didn't matter to our supervising physician. Everybody had to say something. And when it came to me, I said, well, I would give arnica because it's purple and it looks like a bruise. I'm brand new. I think I knew 4 remedies at this time. And it wasn't that remedy. But we all go around and we ended up choosing lachesis. Some people call it lachesis. I learned it as lachesis, Lachesis. So homeopathic lactasis. And I got sent down to the medicinary to get a dose and take it back to the exam room and give him a dose. And then I was instructed to sit with the patient and mom. And I said, well, how long should I stay? And Dr. Messer said, oh, well, we'll see. You just sit with them for a little bit. So I go down, I get the remedy, I come back to the exam room, give it to mom to give to her son. So she puts it in his mouth. And we started chatting, mom and I did. So she was fluent in German, and it had been a long time since I'd spoken German. So we were kind of chatting. I was getting to use some of my German, and I didn't know much French at the time. And she was talking to me about how she was raised using homeopathy as her main form of medicine and how she was raising her children that way. And, we chatted, and I don't know at what point things had changed, but it was about 5 minutes before I noticed that the little boy, instead of being draped in her lap like a limp rag, he was sitting up and rummaging around in her purse. And she said, what are you looking for? And he said, crackers. And she said, oh, okay. So she reaches in her purse and she gives him crackers, and he's sitting there happy as a clam, no longer pale, munching away at the crackers, no longer moaning, a little chatty, just sitting on her lap. He was clearly hungry, and then he wanted some water. And I said, I'll be right back. So I slowly go out of the room, shut the door, and zoom down the hallway to the exam room or to the clinic shift room where they're discussing other cases. And I come bursting in, and Dr. Messer stops the shift discussion, which was probably very irritating to students who were just wanting to get their cases heard so they could figure out what to do with their remedies with their patients. And he said, yes, Eli. And I said, okay, something happened. That little boy is now sitting up eating crackers. And Dr. Messer said, really? Let's go take a look. And I could hear the other students in the room groaning, right? Because now they were going to have to wait for him to come back to finish talking. So we go strolling down, he and I, and probably the case manager, go strolling down to the exam room, and he looks in the ear and he hands me the scope and he says, well, take a look at that. So I look in there, perfectly pink, healthy looking eardrum. Like not purple, not bulging anymore. And by now the kid's wandering around the room. He's touching everything. Mom's trying to corral him. And I looked at Dr. Messer and I said, wow, that's wow. He's like, yeah, it is. Why don't you get him let's get him down to the medicinary and get a little bottle of that just in case she has to redose it. And he told her, if any symptoms start to come back, like moaning or holding his ear or anything like that, you redose again. I think he told her to redose before bed. I don't remember that detail. All I remember is this very sick little boy with an eardrum that looked like there couldn't be anything more painful. Within just a few minutes, sit up, and everything completely went back to normal. Turns out she never gave him another dose. That one dose was enough. It was at that moment, right then, right there, that I knew I absolutely must learn this treatment modality for my practice. And as I went on through school and in my early years of practice, I realized that there were many, many, many times where if a parent had, or anybody had, some basic knowledge of homeopathy, that for first aid and acute situations, cuts, bruises, sprains, strains, coughs, things like this, if they knew enough about homeopathy, they could likely give remedies from a home kit and avoid the cost of having to go in and work with doctors who didn't have anything better to offer, in my opinion. And so shortly after starting practice, I started teaching people how to use homeopathy, how to learn it, how to understand it, how to understand a handful of basic remedies that cover many first aid and acute situations, how to dose it, how to keep dosing it, when to stop dosing it, explaining how remedies are made, and all of this stuff. And created a lot of sort of junior home practitioners that somebody gets a bonk on their leg or their finger or their arm, and they know to reach for arnica, or in some cases ruta or bellus perennis, for situations where there's a knife cut, like you're slicing something, or you get a burn while you're in the kitchen or outside in the shop, or get punctured by a hook when you're out fishing, or get bit by some animal, get stung by an insect. There's so many daily uses of homeopathy in first aid in acute situations that can be easily learned by everyday folks without medical education. And especially for those who have some medical training, this can be a very powerful tool that can be used. And so after 20 years of using this in practice and teaching hundreds and hundreds and hundreds of people the basics of homeopathy and how to use it at home, I put it in a book so that I can get it into the hands of even more people. It has a basic teaching of the foundations. It's called a foundational approach, the basics of homeopathy, the basics of taking a case, of knowing when to change the remedy or change the strength of the remedy. And while this is for first aid and acute, the basics are true for any kind of practice. I have another book in me on chronic care, chronic treatment, which I'll be working on over the next couple of years, but this is the place to start. Everyone should have a kit at home with some basic remedies in it, and I go through that in the book. There's a little guide, materia medica, we call it, for when certain things happen, which remedies to consider. And while they might not be the only remedies, they're the most common. And it's available. I have it here in my office. It's on Amazon. It's at all the major booksellers. And I really hope that you fall in love with homeopathy the way I have. I've used it. It's the primary medicine I use with my kids and all of my patients. And I hope you enjoy the book. Thanks for joining me today, and I'll see you next time.